Welcome to Talk 1260 Key.
I'm sorry, I wasn't rolling.
Okay, we're ready to
Start
go.
over. Okay, sorry about that. Okay, sound speed and camera is rolling.
Welcome to Talk 1260 KTRC. You're listening to Western Medicine, the Humanity Behind the Vanity. We're talking about realistic plastic surgery. This is Dr. Daniel Ronel. I'm here with my wife, Betsy Ronel.
Howdy.
And we are generously sponsored by the makers of Artifil and the makers of the OnQ pain pump.
Right.
We're going to talk about that today. One of the things that I like to do with my large procedures in plastic surgery is to diminish the amount of pain after surgery. And this iFlow company developed the OnQ pain pump, or the pain buster. And what it is, it's a balloon that you can see right there. It's filled with an anesthetic medicine.
We're filming for YouTube and our reality show, which is why he just said that you can see. Okay.
That's right. It's a balloon filled with an anesthetic, non-narcotic medicine, and the balloon slowly contracts over about 3 to 5 days. And as it contracts, it shoots in the pain medicine through tiny little tubes, just
It's
like
tiny.
this one.
It's a little bit larger than the size of a pinhead.
Right.
It's tiny.
And it delivers the anesthetic right to the site of surgery, whether it be a breast surgery or a tummy tuck or a buttock lift. And the studies all show that patients who have these pumps take fewer narcotics postoperatively. They still get narcotics, and nobody gets a medal for being in pain, but this really helps the recovery. And those first few days after surgery can be kind of rough, and this really helps it along.
What are the surgeries you use this for?
I use it for almost all my tummy tucks, most, if not all, of my breast reductions. And I was using it for my breast augmentations also.
Yeah, I had these.
And I've started to not use them as much
I don't
with
think they're
those.
necessary for that.
Yeah, because those surgeries they're really not that painful, and there are new techniques that we use which really make them not painful at all. So, but abdominoplasties, the tummy tucks, anything with a big body contouring like
Can
a
you give me
buttock
this after a
lift.
C-section?
Sure,
Oh,
absolutely.
Good. I'll tell my OB. I'm not pregnant, but should the day come again?
Yeah, no, absolutely. And so, and they're safe, which is great. And the medication that's used is usually Marcaine or bupivacaine, which is just a longer acting lidocaine. That's what you use to get stitches. And then removing the catheters
I've removed them myself.
Yeah, is pretty much painless. Sometimes I have patients from out of town just do it at home.
Right.
And
you don't feel it.
No,
it's nothing. You're all numbed up.
Right, it's not a big deal.
And when you're wearing it, if you're active with it, just even lying in your bed, you wear it in this little fanny pack.
Right, right.
It's very cute, and you actually can keep it. And if you don't want to be advertising because they're not paying you, you just turn it around. But it's very nice. I've actually kept these because I had one. Oh, I've had two, and I used them for, like, at the time, baby things for my baby stroller.
Right. So it's called the Pain Buster OnQ Pain Pump. There are other companies that are making these also. I happen to like this one because they were the first ones on the block. They now have an antibiotic impregnated tube. Not that there were any infections. I actually never had any infections, but I think they're sort of thinking ahead, trying to be on the cutting edge.
And protect themselves.
Right. Nowadays, in fact, a lot of sutures are coming out from the manufacturers impregnated with antibiotics.
Great.
Yeah,
That's very
so
smart.
that may be the wave of the future.
So that's the OnQ Pain Buster.
Yeah, and the manufacturer is iFlow, and they really have their act together. I like that.
Yeah, they're a forward-thinking company.
Right.
Absolutely.
Drawbacks. There potentially can be a problem removing the catheter. Very rarely it can actually kink inside, and then it has to be manipulated in order to take out. There are some reports of the very tip of the catheter popping off, which is totally fine.
Right.
I mean, it's a sterile, it's like an implant. Hello?
Right.
If somebody has breast implants, they have two very large foreign bodies in them. So it's a really nice, safe thing.
Yeah, and the thing is if it does have to be manipulated within your body, you're already numbed up from the medication. That it's not like you're going to feel it.
Yeah.
Pretty for the most part. That didn't happen to me, but that's my assumption.
But in any that's only happened to me 2 or 3 times
Okay.
out of hundreds and hundreds that I've used.
Right.
So,
That's a great product.
yeah.
Excellent.
Okay.
So do you have, well, how about the knowledge? Do people know about this ahead of time? Do they ever come in and say, I want one of those pain busters?
Very rarely. I have it on my website, so if somebody's looked through my website, they come in expecting it. But most people don't actually know about it.
Oh, yeah.
Yeah, it's funny. I've had a couple of patients who have said, "Oh, yeah, my husband got that when his shoulder surgery or his knee surgery."
That was my next question. How
Yeah.
many other types of doctors use this?
Yeah, orthopedists use it, thankfully.
Right.
General surgeons
Okay.
use it, not enough.
Yeah, you should hear that?
Yeah.
General surgeons?
And
Good
some
stuff.
oncology surgeons are using it
Oh, that's
now.
great.
Yeah, which is
That's great.
those are big cases. So.
Yeah.
Right. I just more people need to know about it.
It's so, I mean, like they've started, all these companies, these medical companies have started advertising to the consumer for consumer advertising
Right.
on TV. iFlow has not done that yet, which is
No,
why the
they-
awareness is down.
Right, no, that's right, they haven't
Right.
yet, and I think that would be a very smart idea for
Yeah.
them to do,
Yeah.
because a lot of,
I'll take
as
my
the dr-
commission in
Yeah.
$100 bills, please.
Okay, you know, as the
Okay.
drug manufacturers have realized, it's consumer driven.
Okay, great. Well, thank you, iFlow. Truly, we appreciate your sponsorship, and we are proud to promote your product.
Absolutely. You have been listening to Talk 1260 KTRC Western Medicine, the Humanity Behind the Vanity. We're going to be right back with a fantastic spiritual tip from Scott Thomas.